Kia ora, I'm Dr. Helen Fulcher, and now I'm talking with Samantha Murton, who's a general practitioner and the president of the Royal New Zealand College of General Practitioners. Hi, Sam.
Hi.
Now we're going to talk about bullying today.
Oh, yes, I know. And sort of the research that we did was sort of, you think, oh, we wouldn't necessarily be bullying in general practice, but yeah, it's around.
Yeah. Can you tell us a little bit about the research and what it's focused on and what you found?
Yeah. So we started this research before I got into my role that I'm in now, which is president of the college. So the research was based because the surgeons had come up with some stuff and sort of said, bullying is common. And then we did a survey of our members about in 2017, I think it was, and asked, and we had a reasonable number came back in the survey, and the stats were that 11% who said that they had been subject to bullying of some sort. Yeah. So then we decided that we'd go out and do some research, and in fact there has been no research done globally in bullying in general practice. So it was sort of like novel and new.
Yeah.
And we put out offers for people to come and talk to us, and we had an amazing number who came in and said, and we've interviewed, it was qualitative, so we've done interviews, and the numbers that are not huge, but it gives us a flavour, because qualitative, you just get once you've gone through lots, you sort of get the similar themes coming through.
Yeah.
So, it's been interesting, because you sort of, you think, not on my watch, it shouldn't be happening in general practice, but actually it does. And there's some little tricks and things that would help people think about it too. Yeah.
So the themes that you found, are they ones that we would all recognise, or were there ones that were unexpected?
I think most people will recognise them. But there are a few little quirks about general practice that go, And so things like the whole business stuff, we aren't necessarily trained to be business people, and then we get into a role where actually it's all about our money, and you've got a group of partners who may not necessarily coalesce together regularly anyway, and are partners because in their small town it's cheaper to have them all in the same building, or they are in an area where they've slowly added people to and they've suddenly become the associate or partner or whatever, and then they think someone's attractive and sort of bring them in, and then they go, oh, actually we don't quite gel, and so it's hard to know and what's going to work as a partnership. And because everything about money we tend to get a little bit passionate about, it can cause us to behave in unusual ways. And therefore that business partnership side of things was a reasonably common theme. The other things were seeing the bystander stuff, so seeing stuff going on, and if you weren't in a position of authority, how would you deal with that? And we had a few people many who would sort of like, oh, we just sort of didn't know what to do. And one who said that I did do something and then got accused of bullying myself. And so that's a common thing that happens in all bullying research that we find. And I think it's pretty hard, but if you let stuff go, then actually nothing will ever change. And I was saying earlier that we were talking to someone today about the fact that there might be things that are going on in practice and that would different, and would you talk to that person about them? And they're sort of like, oh no, I wouldn't. And you sort of go, well, actually you're not very good at talking to another colleague and saying, what you're doing is not working for me, or isn't working for the patients, or whatever it might be. And that's a hard conversation to have.
It's quite difficult to be on the receiving end of that
conversation. Yeah, it is really difficult, and I think you have to be very careful. But we think we're good at doing it with patients, and in fact, that's fine. Our patients aren't necessarily a threat to us, whereas if you go to a colleague, that actually feels a whole lot more threatening, and we're not trained.
That's
right.
So
it's really tricky. The other thing about general practice that I think we don't even think about is that actually we go and have one-on-one conversations in a room with the door shut. Now, in an HR process, that's completely wrong.
The wrong way to go about it.
It is totally wrong.
It's true.
And so if you're going to have a conversation with someone about something that's a bit hard, and that you need to be able to give them some feedback, keep that door open. Do it in a forum that is open, or say, I'd like to talk to you about X beforehand, and then where can we do this, and set it up properly beforehand, because the number of times people have said someone came into my room and shut the door was unbelievable, but it's our normal practice, and we need to just think about that, because it seems to get people into trouble a lot. I think in general practice, the other thing that we don't have necessarily, and as our practice managers get more skilled in things, the whole HR processes and those sorts of things, we don't have them so well defined that we normally would in a bigger business. So it's probably something that our practices need to consider and have it very clear what those HR practices and who the person to go to is.
Yes.
I think the other thing that we need to do is actually expect our management to step up. So if you have got a staff member who is causing havoc in some way, then there needs to be a very defined process about dealing with that. And the problem we have is that if you're in a small rural community and said person happens to be the supermarket owner's daughter or the son of the truck driver or whatever, then it actually causes a little bit of havoc in the community. So it's actually a very tricky way to have to deal with stuff when you're so closed community. So it can cause a lot of trouble. I think as we go on as a nation, you know, being able to say kindly, you know, this is not an appropriate behaviour is what needs to happen.
Did your research look at solutions, or have you come up with any solutions having looked at the research?
So our solutions would be things along the lines of making sure you've got good policy, you've got actually good procedures that they're discussed in the practice, that people are aware of when a discussion's a good discussion or not a good way to have a discussion, that they seek advice, and WorkSafe's very good with doing all those sorts of things, and also that I think there's sort of a gap in the market in that MPS is about looking after our clinical skills, the medical council's looking after that sort of side of things a bit. MAS will have some business stuff, but it's not too much. And if you don't belong, then you don't go there. And then the college, from our perspective, yes, we look after members, but we're not necessarily able to deal or help with this is your partnership breakup issue. And it's often a relationship breakup. And because it becomes quite fraught, people need somewhere to go to. And I think that's what we need to sort of think about is, you know, all those industries together looking at how we can help to support practices. But I think the biggest thing is learning to have the conversations without yelling, slamming doors, putting people off.
And I think I mentioned briefly just before we started to you, Sam, that are we evolved within medicine to become bullies by our training or our practice, or do you think it's something that is put upon us by the situations that we're in with our practices? As you say, we're not taught in business, so therefore we're thrown into the deep end and we're just doing the best we can, and it sometimes goes wrong.
I'd like to think that actually we are evolved, but I mean, you and I know, I mean, I'm a little bit older than you, but you know, we've gone through and we've seen people who've behaved badly throughout our careers, and I'd like to think that with the call out from the surgeons and various other places that actually that doesn't happen anymore. I have, when I was young, I had a senior colleague who got upset with me and then went around the hospital asking where I was, and so every time, and was really mad, and so told everybody that he was really mad with me. And I was so angry. And it wasn't until about 3 or 4 days later that I saw him and I said, look, I have to have a chat with you. And I actually, you know, my heart was pounding, but I said, you know, you can't, if you're cross with me, you tell me. You don't tell the rest of the world. And you know, that sort of behaviour has gone on in the past, and it's sort of like I think it's not even been thought about. And I think that's the thing. People need to be able to reflect back and go, well, is actually my behaviour what I'd like to receive? And is my behaviour appropriate for the situation?
That's
and there's lots of training courses about looking at sort of like, how do I sort of step back, think about what's actually going on, what the scenario is, and what the key issues are without going in and attacking first. So, you know, count to 10, really good idea. Sleeping on it, really good idea. I remember getting frustrated by something once, and I spent a whole weekend going, I will not get angry, I will not get angry, and sort of like working out what it was that I needed to do that was going to transform that situation. And so I think we do all have to behave better. We are professionals, we're professionals in front of our patients. Sometimes we forget to be professional with our colleagues, and that's not fair.
So there's the individual things and there's the practice things that can be changed, and that is an evolving process, isn't it, in these business times. So thank you, Sam, you've got a lot of information there. I appreciate that.
Pleasure.
Thank you.